ਵੈਲਕਮ ਟੂ ਮਾਈ YouTube ਚੈਨਲ ਗਾਇਸ। ਸੋ ਅੱਜ ਆਪਾਂ ਡਿਸਕਸ ਕਰਾਂਗੇ ਮਸਕੂਲੋਸਕੈਲੇਟਲ ਦੀਆਂ ਦੋ ਡਿਜ਼ੀਜ਼ ਕੰਡੀਸ਼ਨਸ, ਦੈਟ ਇਜ਼ osteoarthritis and rheumatoid arthritis. ਸੋ ਬਹੁਤ ਬੱਚੇ ਕਨਫਿਊਜ਼ ਹੁੰਦੇ ਆ ਬਿਟਵੀਨ ਥੀਸ ਟੂ ਕੰਡੀਸ਼ਨਸ। ਸੋ ਅੱਜ ਮੈਂ ਤੁਹਾਨੂੰ ਇੰਪੋਰਟੈਂਟ ਪੁਆਇੰਟਸ ਦੱਸੂੰਗੀ ਅਬਾਊਟ ਦਿਸ ਕੰਡੀਸ਼ਨ। ਸੋ ਲੈਟਸ ਸਟਾਰਟ। Rheumatoid arthritis is a autoimmune disease and osteoarthritis is a degenerative and wear and tear disease. In rheumatoid arthritis, small joints affect, like joints of fingers, these fingers, small joints affects. And in osteoarthritis, large joints affect, like knee joint. Rheumatoid arthritis is a disease of young females, young people. And osteoarthritis is a condition of old age. And usually in osteoarthritis, like unilateral large joints like hip joint, knee joints are affected. Example, if a young woman with the swollen joints, it's most probably is a rheumatoid arthritis. So rheumatoid arthritis is usually symmetrical. Example, the joints affected like hands, fingers, wrist, feet, like both wrists, symmetrical. Both knuckles, your finger joints, both symmetrical. Your both feet, symmetrical. But in case of osteoarthritis, this is asymmetrical, right? Unilateral. Like patient complains about one side of hip pain, patient complains about one side of knee joint pain. So conclusion is, in rheumatoid arthritis, symmetrical joint affected. Like example wrist of both hand, both wrist hand will be affected. But in case of osteoarthritis, only one side, will be affected, like maybe the right hip, maybe the left hip. In case of rheumatoid arthritis, pain improve with movement and worse with rest. Opposite in osteoarthritis, pain worse with activity and improve with rest. In rheumatoid arthritis, there are systemic signs and symptoms. Example, fatigue, fever, weight loss, malaise. But in case of osteoarthritis, there is a no systemic symptoms. Patient said that when I wake up in the morning and I feel like my joints are stiff, I'm not able to move. But when I start activity, when I start movement, I feel relief. This is rheumatoid arthritis. On the other hand side, patient comes to you, said that there is a knee pain problem, and when I start moving and do the activities, my pain worse. But when I go for the rest, when I take rest, then it will improve. This is osteoarthritis. Simple, in case of rheumatoid arthritis, rest worse the condition. In case of osteoarthritis, rest improve the condition. Okay, at last, let's do the conclusion and differentiate between these two. Okay, rheumatoid arthritis is an autoimmune condition. Osteoarthritis is not the autoimmune, this is a wear and tear condition. Rheumatoid arthritis is a kind of young people condition, usually between 30 to 40, 45. And osteoarthritis is a old age condition. Rheumatoid arthritis condition worse with rest. In osteoarthritis, condition improves with rest. In rheumatoid arthritis, there is a systemic symptoms. But in osteoarthritis, there is no systemic sign and symptoms. In rheumatoid arthritis, the labs are like RA factor check, ESR, CRP factor check. But in case of osteoarthritis, the normal blood tests. In case of rheumatoid arthritis, the first line treatment is methotrexate. And in case of osteoarthritis, the treatment is NSAIDs and acetaminophen. Rheumatoid arthritis, the NCLEX priority is to prevent joint destruction. In osteoarthritis, relieve pain and maintain the mobility. In rheumatoid arthritis, symmetrical joint involvement, like if one joint involved, other joint is also involved, like both. But in case of osteoarthritis, asymmetrical, like only unilateral, only one side of joint will be affected, like maybe one side hip joint, maybe one side knee joint. These are the important points related to rheumatoid arthritis and osteoarthritis. So मैं पहले जो एक वीडियो पाई सीगी ऑन इंस्टाग्राम, लाइक एक डिजीज कंडीशन, एंड डिजीज कंडीशन का आंसर सीगा दैट इज माइस्थेनिया ग्रेविस, एंड अ लॉट ऑफ स्टूडेंट्स कमेंट दैट दिस इज osteoarthritis. Guys, that was not osteoarthritis because I asked about the muscles, not about the joints, right? So yeah, this is all about the rheumatoid arthritis and osteoarthritis, and I give you only the important points about these conditions, and that's it for today. I hope you guys understand this topic, and bye for now.